Hello, welcome to Aging Well in America. My name is Anne Marie Gattari, your host. Every day, up to 10,000 people in the United States turn 65 years old. 5.5 million people are aged 85 and older. By the year 2050, which isn't all that long from now, 20 million people will be aged 85 or older. Are we ready? Is America ready? There's so much good work going on around the country, around the state, and right here in our own community. And we have with us today one of those people who is doing some of that good work right here in our community. Anne Sadler, thank you so much for joining us.
Well, thank you for inviting me, Anne Marie. I'm excited to be here today.
I think a lot of our viewers probably know you or have heard of you. You've been in the community working on behalf of seniors for 30-some years. Correct. As an advocate in general. You've done several things, but currently you are a very thorough and accomplished care manager, geriatric care manager.
Correct.
And I'd like you to explain to our viewers, what is a geriatric care manager? And I know you've got a wonderful graphic there if you want to use that.
Well, a geriatric care manager, first of all, is someone who is experienced and trained and educated in one of the social services, especially relating to seniors. So social workers, nurses, and other people in the helping field. And I belong to the National Association of Geriatric Care Managers, which is important distinction because it's a credentialing body. And
if I can interrupt you, so
yes.
what were the requirements to become accredited by this organization?
Basically going through making sure that you have the training. So many people these days are popping up and saying they can help take care of our seniors,
sure,
but they don't really have the training. And as you said, I have 30 years. So I have a social work background. I'm a licensed nursing home administrator, although I'm not using that license currently.
Okay.
And started out actually in the business in 1984. Some of your viewers may remember the Gateshead Senior Center. Gateshead. And Lutheran Social Services ran that, and I started out there as a volunteer.
Oh my.
And then they hired me within a few weeks, and from there I was helping do some outreach in the community. And then was hired by the Sisters of Bon Secours, which a lot of your viewers will also remember, and was with them for 9.5 years, eventually running their nursing facility, which is now Shore Point.
I see.
But it was, I started there a year after they opened.
Okay.
So I have 16 years as an administrator and 30 years in the business.
Wonderful, wonderful.
So a care manager, to belong to the association, we have a pledge of ethics, we have standards of practice, and basically we are modeling, the association is modeling our requirements on licensed social workers. We're an emerging profession, and we really want to set ourselves apart from the free services, from the other people that are out there that may or may not really have the qualifications to provide the care, to do good, advising and assessment.
So you spend a lot of your time to build your resource list, really almost interviewing the professional community, those who you...
Correct. So
that you can develop a relationship with them certainly before you begin to refer.
Correct.
Is that correct?
Yes.
And what does that kind of scrutiny process look like? How do you, for instance, an elder care attorney, how do you decide who will be on your referral list?
You know, it depends on the situation, but for an attorney, I'm looking at experience. Do they have the specialty training for elder law? What are their reviews? What other people have used them? And I do the reference checking.
You do?
And absolutely.
Okay.
Absolutely. For home care companies, I look at their hiring and training. Do they do background checks, drug screening? What is their model as far as their business model? Do they have nurses supervising? But having run nursing facilities, I'm pretty selective about which companies and providers I will use because when I refer to my clients, I want to make sure that there's no there's no mess ups, that there's no mistakes that we have to fix.
Absolutely,
So
because all of that
reflects back on me.
reflects back on you. That's,
Exactly.
That's absolutely
Exactly.
true. So when I just want to give you a scenario, I'll
Sure.
give you my own, for instance. And this is all, years ago. Both my parents have since passed, but there was a period of time, about a year and a half, where my sisters and I have 3 adult sisters in the area, so there were 4 of us, well-meaning, hands-on sisters, and we could not do it alone. My mom was 88 at the time, my dad almost 90, and he was as sharp as a whip, no dementia. My mom fell down the stairs, broke her leg, dementia, comes home, needs pretty much round-the-clock care. And I remember at one point he was sitting in the corner of the living room, and we were just coming and going. There were us, there were hired people, there were family members,
Sure.
husbands, grandchildren, anybody we could get, because somebody had to always be there. And my dad's sitting in the corner, and he says, I just can't wait till all this is over and we can go back to normal. And my sisters and I looked at each other and we said, this pretty much is his normal.
Right.
What could you have done for us? Take us through your process.
Okay.
I call you and say, my mom just got back from the hospital. She can't bear weight, and the rehab center, actually she went from hospital to rehab, they sent her home saying that she had plateaued because she could not.
Sure. Sure.
She couldn't understand the instructions anymore.
Right.
So she came home non-weight bearing with a leg in a cast. She's 88 years old and she's in a wheelchair.
That's the scenario.
That's and there are
the scenarios are different
there's
for
no
everybody.
Nursing in our
so so I jump in at all different phases of the process. In that particular scenario, the first thing I would want to do would be to come to the home and do an assessment. And that assessment is pretty broad in scope. I would look at both mom and dad, since you said dad was also part of the process. I would look at their mental status. Is there any dementia, memory loss? Are they capable of, doing things for themselves? How are they doing getting around? Their ADLs, their activities of daily living. Can they dress themselves? Can they be in the shower on their own, or do they need assistance? I look at financial resources. What's the long-term plan, especially when there's a couple? There's VA benefits, there's Medicaid, there's lots of different things, but we have to look at what's the long-term plan so that we're not spending all the money on one person and leaving the other person destitute 5 to 10 years down the road where they have nothing.
Right.
So I look at that. I look at legal. Do you have the legal paperwork in place so that someone can help with medical decision making? And if something happens and mom and dad can't do financials, maybe they're already at that place and maybe you're already doing that for them. But do we have the legal authority to do it, or do you just have your name on the checkbook?
Right, right.
Which isn't the same thing.
Exactly.
So we look at that. I do mental health assessments, so I do what is called the mini-mental. I also do, I'm actually the only person in Michigan doing the reality comprehension clock test, which is a nonverbal test that allows me to get that person's actual functional age, which for many families, finding out that mom or dad has some memory loss or a dementia doesn't really help them in terms of, well, how do I manage that?
Exactly.
So having the RCCT, it tells me, are they functioning at 7 years old or 5 years old? A 5-year-old probably shouldn't be left home alone. So it gives the family some really a better guideline, because the doctors will say, yes, you have it, and good luck, and here's the number for the Alzheimer's Association. But they're not really able to provide you with how do you deal with the behaviors, how do you deal with all that. I do a home safety assessment. Are there stairs? Do we have, can they manage on the first floor? Do we need a lift to get to the second floor? All of that. So it's, again, pretty comprehensive. I look at depression. and pretty much anything related. And then from that, I do a plan. I also talk to the family members to get a feel for who's available to be able to help, who truthfully can help, has time to do
and
that, and the willingness
capacity,
and the
right?
emotional capacity.
That's so much.
Not everybody does.
Right.
And those dynamics between parents and children are not always what we'd like them to be when it comes to this point. I know my mom had Alzheimer's, and I was her primary caregiver for 12 years.
Oh, my.
And there were 5 of us kids, and Mom and Dad had put me in charge legally 10 years prior to them needing my help. But I was the bossy daughter who was ordering her around and making all these changes and trying to protect her and keep her safe.
Sure.
When in fact, you know, the other kids were just the person that she complained to. And that is very, very often, actually more so, probably 98% of the time, I can come in and help a family where the children can't, because you'll never be anything but a daughter.
That's right.
And
That's right.
Dad will always want to be in charge,
Right.
and Mom will want to be in charge. But a third party can come in and be objective, look at the whole big picture, and then present a life plan that includes everybody.
Right.
So we can bring in home care, get an elder law attorney, somebody to help pay the bills if there's nobody that's willing or able to take that over. A lot of my clients, the families, are out of state or at a distance, and so I actually oversee all of that. In your situation, it would be maybe doing some family mediation if you weren't all on the same page, which happens a lot. I've had as many as 12 siblings, and trying to get them all together to agree that Mom and Dad really do need this help, and they need it today, is sometimes a challenge. So I do end-of-life counseling, which is sometimes appropriate. But basically coordinating all that, sort of like a general contractor. I don't do the hands-on, but I bring all of those resources that I vetted and screened, so that families don't have to waste time and energy and stress, you know, going down the wrong path, getting a hold of a bad company or somebody that takes advantage of them. Not that there's not plenty of people out there that are good, but there are people out there.
Well, someone really, they almost need someone to do the comparisons, right? You've told me about a service where if someone is debating, really trying to decide between, do we come home from the hospital or do we go to assisted living, you can gather all of their facts and go get the cost.
And that is actually part of the process, depending on, again, when I'm brought into the picture. If we're at that place where we're trying to decide, is it time for assisted living, is it time for, you know, Medicaid, is it time, can Mom come home, then I use that information I've gathered in the assessment to determine whether or not home is really an option, and what are the financial resources.
What is the reality?
Is there a VA benefit? If there is, that could be between $1,000 and $2,000 possibly that would be available a month to help out.
Which is a huge help for a lot.
And if not, and there's a couple, like in your scenario that you presented, what are we looking at in terms of the medical diagnoses? You know, how long do we have any kind of a projection?
Well, you know, it's
as
interesting.
to what's going to happen.
And I'm not sure how common this is, but at the time, at my mother's doctor's recommendation, my mom went on hospice a couple months after her surgery because she kept going back to the hospital, right? So she went on hospice. And then my dad got a lot worse. Oh, he had a fall. That's right. He had a fall, too. And he was in the hospital and then rehab. He came home. They wanted to actually, she now was graduating to come off of hospice. And so my mom came off and my dad went on hospice. So we had all of that going on. And my dad passed like within 2 weeks of coming home after the rehab. And my mom lived for 2 more years.
Yep. and there's no way to know that.
Yeah.
But we can sort of look at, you know, and project some of that. Or we just do planning, you know, if this, then that.
Yeah.
But at least you have a guide.
Exactly.
So sort of like when you take a journey, you know, my tagline for my company is Unraveling the Maze. People enter that maze at all different points in the process.
Right.
What I help people do is I guide them through and I know where the detours are.
Yeah.
I know that what is the likelihood mom's going to end up back in the hospital in the next 6 months.
Right.
Based on her medical
issues. And you know
issues.
it based on your experience.
Correct.
Because you have seen so many scenarios.
30 years is a long time to be just in long-term care serving seniors. Yeah, I've seen a lot.
Yeah, you've been there through all the changes, trends.
Yep.
Going.
And even with my own mom, being her primary caregiver for 12 years, Dad had passed suddenly. And we didn't really realize how bad Mom's memory was because Dad had been covering and they lived in Florida a lot of the year.
Yeah.
So, you know, personally, I had to help Mom through that first year after Dad passed, then move her to assisted living when it was clear she wasn't safe any longer at home. Then from assisted living, she was doing pretty well. And one day she just walked away from the facility. Totally, she was the one who used to sit at the door and tattle when anyone went out. And so I facilitate 2 of the Alzheimer's support groups. And I tell families that all the time, you think it won't happen, but it happened to my mom. She was the policeman at the door, and the staff got so accustomed to that. The day she packed up her teddy bear and 2 tube socks filled with an extra set of underwear and some silverware. She was gone for almost 7 hours.
Oh, my.
And we had the dogs and helicopters and everything looking for her. We were on the news that night. So it was pretty traumatic because we don't know when that's going to happen. So part of what I do is helping families prepare. Once we've identified, especially a dementia, you know, making sure that chemicals are locked up. Right. Helping them understand how to communicate with their loved one. I'm pretty passionate about dementia. I'm a certified dementia practitioner, and I help families understand that when a person has dementia and they are moving further along that process and communication is becoming more difficult, that every behavior is a message. So when Mom and Dad is beginning to have behaviors that they don't know how to handle, part of what I can do is come in at that point and help identify what it is. It could be pain. It could be constipation. It could be something in the environment that the family doesn't realize is happening. That's upsetting them if they're agitated. It could be flashbacks. There could be things triggering them. I've had clients where the family's watching, you know, like MASH was a favorite TV show, but when your loved one is back in their 20s and they were in the Army and saw combat, that can trigger all kinds of other issues for them, and they can actually think they're there again. So I'm able to help with that, sometimes appetite issues, lots of different opportunities for me to kind of help the family with managing that, especially if they're at home.
I want to ask you, I want to get back to the dementia because I have another little story I want you to help me understand. But your dealings with doctors, you know, that's a major issue, I'm assuming, and one that you've done a lot. You have a lot of experience with it. So when a family says, you know, my mom's doctor, we're going to see them, and then he or she will tell us what we need to do, or, you know, there's meds. I mean, how do you kind of traverse the maze of the medical, not only the diagnoses, but the treatments?
Part of what I do, having run nursing facilities and followed the Medicare guidelines of, you know, wanting people to be on 9 or fewer meds, because polypharmacy is a huge issue. The interactions of medications and what it does to people. are tremendous.
Do you have pharmacists on your
I do not have a
referral?
pharmacist. I do a drug review where I basically look at the medications. I run it through an online drug checker, and I don't diagnose, prescribe, or
Sure.
treat.
Right,
That
right.
is, although most people think I'm a nurse because of 30 years of just doing this, but what I do is raise to the forefront opportunities for the family to talk to the doctor about. For example, I had a client who was 90. He'd been on statin drugs for probably 30 years, like from the beginning when they offered them.
Mm-hmm.
By the time I became his care manager, his cholesterol levels were so low, both his good and bad cholesterol, they were almost not even there when they did the blood work on him. It took me 2 visits with the cardiologist to get him to look at those, and all of a sudden he said, oh my, we have a nutritional issue here, because they had just continued and no one had questioned.
And what was
for 30 years.
What was the outcome of that? How did
He took
it
him off
affect-
the statin drug.
But what did that do to the man's health? I mean, his.
Well, at that point he
what
was
were you
90
seeing?
and he had a lot of other issues, but you know, just getting him off of a drug that has side effects
Right.
was helpful.
Right, right.
You know, anytime you can get rid of a
Sure,
medication.
sure.
I mean, there's lots of alerts about the statin drugs, whether
Yeah.
we should or shouldn't take
Right,
them.
I know. Yes.
And oftentimes families just don't have the background. It's not that they don't want
Right.
to; they trust the physicians. And so being able to have me help them have a healthy discussion about dementia medications, the efficacy of those meds, pretty much the research shows after 2 years they're probably not helping much in terms of delaying, because they don't cure, they only can delay.
Correct.
So having that conversation and saying, you know, this is something we might be able to get rid of, looking at some of the other things that they're taking, are they contributing to the person's health, or are they creating side effects that maybe now we're treating with another medication?
Right.
Because that often does happen. And on the flip side of that is with the dementia folks with behaviors, there's research that shows that we can reduce a lot of behaviors in folks that have dementia by treating them for pain, because they can no longer tell us they have pain. And so we see orders for people that are in their 90s, and it says Tylenol as needed, when actually they need it round the clock, because who at 90 doesn't wake up with aches and pains?
Right.
So, and then the behaviors, because the pacing, irritability, a lot of times it's pain. And so I can say, let's try this, making sure that they're, you know, on schedule with their eliminations and bowel and bladder, those kinds of things can be huge. It's simple things, but a family that's not trained just doesn't even know to ask the questions.
And you often hear, well, I did it myself, but she's always been like this, or, oh my goodness, she just said this and she's never said that before. But you know, what does really, as you said, you know, they're symptoms of what's going on, and you need to pay attention to it, but maybe look at it in a way that a little differently than the family has always looked at.
And that's part of it, is what was mom like? And I have to ask that question: is this behavior different, or is this how mom was?
Right.
Because oftentimes what I see, the generation that we're caring for today, the seniors, mental health was not really treated.
Correct.
It was put under the rug. It was, you know,
it became their norm.
Right, it was their norm, and the family just, you know, adjusted to support that person's behaviors, whatever they were. So oftentimes I run into people who have undiagnosed and untreated mental illness that now is exacerbated by their dementias. And so that becomes more of a challenge.
Aging and changing brain.
Yeah, exactly.
I just want to tell you real quickly another story about my mom. I was just thinking of this the other day. She lived with me for 3 months, October through January of 11, October through January of 11. And then in January 12, she went to my sister's in California, and then that's when she passed 3 months later at my sister's. But before she left, I took her to see her sister, who was a few years younger than my mom. Her name was Rose and Anne. Rosie and Annie, the singing sisters, they called themselves. They were just such a beautiful pair. I mean, they always bragged about how they never argued as children. But my mom always wanted to see her, and I took her to see my Aunt Rose as often as I could. But she'd always say, you know, when am I going to see Rosie? Nobody will let me see her. So on our the last visit, I took a picture of the two of them together. And then a couple days later, she, you know, started crying, I want to see my sister Rosie. I said, Mom, we were just there. And no, nobody will take me. You know, you won't let me see her. I showed her the picture. And she says, well, that's not Rosie. And I said, well, who is it? She goes, I don't know. It's some old aunt.
Okay.
And I said, well, how old is Aunt Rose? She says, about 14. I didn't know what to say. I had no experience with that level. I mean, usually I could come up with something, but that was just, I don't know, it just struck me the other day thinking about it. What would you
I have a lot of resources for that, as far as different books and things that can help families with that to develop. You know, what do you do? I know, because with my mom it was the same way. I said, let's go down to lunch at the facility, and she'd say, I can't, I'm waiting for my parents. And you know, being trained and quick on my feet, I was able to say, oh, I forgot to tell you, your folks said that they were delayed in traffic, we should go ahead and eat without them, and they'll be here later. So, but oftentimes the situation that you presented, you might say something to the effect of, oh, well, tell me, what was the thing you liked most about Aunt Rose?
And then just start
and let her, because she obviously was at 14.
Yeah.
Your mom had, you know, was in a place much younger. Yeah. And so redirecting her thought process to something positive, a good memory, or, oh, that's, I remember, you know, you and Aunt Rosie always sang. Right. What was the favorite song? Something to get their mind.
So, like you said, something to redirect them to make it a positive outcome.
Correct.
Anne, you're not going to believe it, but we've come to the end of our show.
Oh, my. That was quick.
I know. Thank you so much for sharing this time with us. Call us with your ideas here at the War Memorial for future shows.